Hello, everyone. Like I've talked about before, we've taken a different approach at the academy in terms of how we hope to teach clinical examination. The reason is because there's a lot of videos out already that teach clinical examination in terms of skills wise. What we think is missing is the script behind the mind of, for instance, a student when they need to perform a clinical examination under the tight 9 minutes of an OSCE. And now I would like to talk about examination of the mouth, which would be required to be performed by medical students, especially in rotation or placements in otorhinolaryngology or ear, nose, and throat. With that said, the typical approach would be wiper, and wiper is wash your hands, introduce yourself, permission, exposure, and so wash your hand, introduce yourself, permission, position, exposure, as well as reposition. Now, with that said, typically for every examination, it's usually IPPA, which is inspection, palpation, percussion, and auscultation. Not all of that is required in the examination of the mouth. So our approach for a script is once a student remembers wiper, the next thing they need to remember is they need to do an external exam and an internal exam. An external exam largely is inspection. It may require palpation in a few cases, but after that's done, the next thing they need to go on to so an external exam would be sort of like looking at my mouth externally, my lips up and lower, isn't it? Like I said in our videos, is not to teach the exam because there's a lot of videos have done that already. Is to give a script to remember what is required to give a very interesting choreographic performance in an OSCE exam. Now, internally, a very important way to remember what needs to be done is TIPS. So TIPPS. So that's teeth, tongue, trigon, in the retromular triangles, that end inside, the palate, the pharyngeal wall and sulci, that's the pharyngeal wall and buccal sulci. Now, these are inspected, of course, using bilateral mouth spatulas. And then the next is the tongue and salivary, in terms of palpation, tongue and salivary gland. So once this are done, you may also wish to palpate the lymph nodes that drain the mouth. That's usually the cervical, deep cervical lymph nodes, not easy to palpate, but also the cervical lymph nodes. And then you thank the patient, and that concludes the exam. Thank you for watching, and please subscribe to the channel, like, and share with friends.